Hi, I'm Dr. Hema Sathish. I'm a dermatologist by profession and the founder of Cureka.com. I have done few short videos on atopic dermatitis, and today I'm going to talk about cold compresses for atopic dermatitis. Well, I felt this should be addressed separately because this is one thing which anybody can do it at home, and you can decide for yourself if you need it or you don't need it, or you need it for your child or no. Well, the ideal candidate who should do this is somebody who's got very irritable skin, which is itchy, and then you're scratching it. Especially in case of children, they don't realize they're scratching it. Of course, in case of children, if your child is having atopic dermatitis, then cut their nails real short so that they don't damage their skin any further. And of course, you can use this cold compresses. Now, what is this cold compresses? What you can do is you can have sheets of very thin muslin kind of a cloth. You can have them, and what you can do is just soak them in water. It needn't be cold water, it can be just tap water or normal temperature water, and then you soak them in that, squeeze them quite well, leave it a little moist, and wrap the area which is very itchy or which is very sore. You can do this wrapping after your application of your ointments, your creams, your moisturizers, your steroids and stuff like that, and don't wrap it very tight. It has to be done very gently, and a very thin layer can be put on top. And after some time, when it dries up, you can remove it, and if the person is not comfortable, then you can re-wrap the person or use a new cloth to wrap the skin again. So once you do this, the itching is much under control, the absorption of the creams are really good, and the curing time becomes much lesser. So decreasing the mortality, that is the time of agony and pain in the patient, is much lesser if you do these things. I hope this has been of good help to you. In case if you have any comments or any question to ask, please put it down in your comments box and I'll be happy to help. Thank you. See you soon. Bye-bye.